Thank you so much for letting me take a few minutes of leadership to talk to you a little bit about some of the work that we're doing in well-being. So just to level set, we know that burnout and concerns for team member well-being and mental health are real concerns, but that they're not new concerns. We know pre-COVID we were seeing healthcare worker burnout rates as high as 60%, with 1 in 15 having thoughts of suicide. With COVID, we saw those rates increase, and now 5 years since the start of COVID, the burnout rates have not returned to pre-COVID levels, not that those rates were any good. We also know that burnout has real consequences to physical health, to mental health, to patients, particularly with impacts to errors in quality of care, to healthcare systems, and to the community. And we know that asking for help can be hard and perhaps something we've been told not to do or isn't safe to do. I come to you here today because we know leaders have real impact, and we want to make sure that you have the information to understand what we're working on as an organization, where we'd like to ask for your help, and where we'd like to better partner with you. Can you go on to the next slide? And then now the next one. So what are some things we're working on as an organization? Over the next 3 slides, you'll see domains or categories that our previous Surgeon General and research indicates are the areas workplaces need to be focusing on to support worker well-being. In each of these domains, you'll see some of the work happening across the organization, including the great work by our EPIC team to reduce pajama time, the additional PTO time that's been provided, our trainings in suicide prevention and implicit bias, and I should note today is World Suicide Prevention Day, our applications to leading organizations to hold ourselves accountable to national standards for well-being, as well as a new project we've launched in a couple areas focused on irritants to your day, or what we call Pebbles. And while we continue to expand the buckets of work happening in these domains at an organizational level, I'd like to ask you as leaders for your partnership in a couple things. First, to make sure that team members know about available resources to support them. There you go. While they're available up on the link page under the Wellbeing tab, what can we do to make them more accessible by putting them up somewhere, emailing them, or including them as part of your huddles? What can we do to incorporate wellness practices into regular meetings, including things like reducing Zoom fatigue by ending meetings early or adding some components to help decompress during the day? And what can we do to communicate, and sometimes communicate more than we think? Sometimes we don't generally hear team members say, wow, my leader communicates valuable information to me so much. We usually hear the opposite, that we don't get enough communication. So we want to make sure that we're communicating more than we think. And a big thank you to leaders who let us know some of the things that they're working on in their areas to build well-being into their days, from scheduled weekly walks to Zoom Boggle, which I would, by the way, like an invitation to along the way. And I'm going to ask you as leaders for your help with one other thing, and that's to answer the question, and the following question really honestly. How are you doing? And for the vast majority of you, conditioned to say fine or great when someone asks you how you're doing, I'm going to ask it again. How are you doing really? Are you sleeping okay? Are you eating 3 semi-nutritious meals a day? Humans are very much like houseplants, just with feelings. Are you getting out in the sun? Are you drinking enough water? Are you talking to yourself nicely? Are you limiting your doom scrolling? Have you reinvigorated your pandemic-related hobbies? I was going to try very hard to get through this without using the airplane analogy about putting your oxygen mask on first before you help others, but here I am using it. We have to take care of us. The responder stress continuum, which is going to pop up in a minute, is one tool we have to ask you to think about how you're doing. So I'm going to ask you to take a quick second to think about where you fall on this chart. So think about how you're really doing. Where are you on this chart? And depending on where you fall, we have resources that can help. From KGA, our Employee Assistance Program, to our team member psychologists who can provide free confidential mental health services in person here at 10 Columbus or on Zoom, please consider accessing a resource that is available anytime you need it. If it's even a thought in your brain, make the call or send the email. You can also use the stress continuum to assess your team to see what resources may be helpful to support your whole team, depending on where your team is falling. I'll give you a quick minute to think about where your team is and what available resources might be helpful for them. And I'm going to ask you as leaders for one more thing, and then I'm going to be quiet and go away. We are in interesting times right now. Things are happening here at the institution that are really exciting, while at the same time there's a lot of things happening here at the institution that are really stressful and unknown. And the world, wow, the world, it's a lot, and it's scary for a lot of people, and for a lot of people worried about their families. And I can't help but think about how much things mirror what it was like to work here during the height of COVID, when there were a lot of things happening here and the world was interesting. What got us through the COVID period is we came together as a team. It wasn't perfect, but we rallied together as one team. Fast forward, and the world has gotten a little bit spicier and maybe has taken on this sense of us versus them. How do we not have that carry over to the institution or break down what's already here? I invite you to please reach out to myself or anyone working on the Wellbeing Committee to partner with us. What are we missing? What do we need more of? What do we need less of? And what are the conversations we need to have?